So good afternoon, everyone. Thank you so much for joining us today. We're very excited to kick off our August awareness series. My name is Kayla Rogers, and I'm an education and outreach coordinator for the Women's Fund. For those of you who are maybe not familiar with the Women's Fund, we are a not-for-profit organization in Houston, and our mission is to provide women and girls with the tools they need to be advocates for their health. So we do this through focused seminars like today's presentation, as well as curriculum-based classes and publications. All of our classes and publications are free. If you're interested in learning more about who we are and what we do, you can visit our website, thewomensfund.org. There you can also find PDF versions of our publications that you can download to your computer or tablet, or you can find a physical copy or a form to fill out for physical copies of our publications if you're interested in those. So today we have a presentation with Kelsey Barta. We're so lucky to have her. She reached out to us and was interested in giving a presentation, and we felt like it was the perfect time because August is Breastfeeding Awareness Month. So we felt this was going to be a great opportunity to have her come in and speak to us over the topic. So before I turn the floor over, I want to just introduce Kelsey. She is a family nurse practitioner, a registered nurse, and an international board certified lactation consultant. She developed a love of providing breastfeeding support and education while working with postpartum mothers and their infants in a hospital setting early in her nursing career. Her passion for the subject grew after having her first child and personally encountering early breastfeeding challenges. She is a clinical nursing instructor that works with undergraduate nursing students in a hospital setting during their maternal child health clinicals. She is also currently a graduate student working towards her PhD in nursing at Texas Women's University with the eventual goal of performing breastfeeding research. Her research goals are to improve breastfeeding support, enhance maternal confidence, and increase equity of access to lactation care. She lives in Richmond, Texas with her husband and 2 young children and enjoys traveling and spending time with her family. So Kelsey, we are so very excited to have you here today. And I'm going to go ahead and turn the floor over to you at this time.
Wonderful. Let's see. Can you all hear me okay?
Yes.
Okay, perfect. And you can see, and Kayla, I'm not sure if you can spotlight me where I come up as the main presenter here. Let's see. So everyone can kind of see my screen as well. Okay, perfect. Well, hi, everybody. I'm so excited to be here. I love talking about breastfeeding and helping people get the support that they need to meet their feeding goals. As Kayla mentioned, it's National Breastfeeding Month, and this week is actually World Breastfeeding Week. So happy World Breastfeeding Week to everyone. I wanted to spend the majority of this time talking about where you might find the information that you need to meet your breastfeeding goals, but I will briefly talk about the benefits of breastfeeding. So let me go ahead and get started. So I will skip through my bio since Kayla introduced me, and we'll talk about the benefits of breastfeeding first. So here, let me move, I guess, where you can see me. In the first year of an infant's life, and especially in the first 6 months, there are 2 main ways that an infant's nutritional needs can be met, and that's via breast milk or formula. So around 6 months, we start to introduce food and a little bit of water, but the primary source of nutrition is usually breast milk or formula. So we don't do a lot of cow's milk or other drinks like that. There are differences between breast milk and formula that I'll discuss a little bit today. But before I do that, I do have a quick disclaimer, and that is that every family deserves compassionate infant feeding support. Some families breastfeed, some families formula feed, and some families do a combination of those 2. The reasons and factors that go into that decision are sometimes medical reasons, sometimes they're mental health, sometimes it's just a matter of logistics. So for instance, if you have a really short maternity leave, you might realize you don't have a lot of time to get set up with breastfeeding. And then there's also just people have different goals and they make different choices. So all of those options are valid. They all deserve all the applause and support. My specialty is in breastfeeding, as Kayla mentioned. So this presentation will center on how to get the breastfeeding support that you need. But when I discuss the differences between breast milk and formula, I don't do so with the intention of causing shame or guilt. So if you're watching this presentation and you have formula fed or combination fed, or if you haven't had a baby yet and might make those choices in the future, I just want to say great job for making the feeding choice that works best for your family. So, babies need a healthy and happy parent more than they need breast milk. So I do want to just make sure that that is known. But let me go ahead and start with some of the benefits with breast milk for infants specifically. So the big deal with breast milk is the immune support that it provides. In a healthy adult with a normally functioning immune system, they make something called antibodies. So when you're introduced to a bacteria or a virus or really anything in your environment, your body makes these antibodies, which are little fighter cells that help you get over being sick or prevent you from being sick the next time you come in contact with that bacteria or virus. Babies are born with an immune system, but it's not mature. It doesn't function as well as an adult's or as compared to when they're a few years older. The earlier a baby is born, the less mature their immune system is. So the really cool thing about breast milk is that the antibodies that a mother has, either by being exposed to a bacteria or a virus, or by getting an immunization, such as a vaccine, those antibodies, she actually passes into her breast milk and the baby benefits from them. So it's a wonderful thing for babies to have, especially babies that are born premature, more than a few weeks early. It's a great thing for them. I did want to make a special note about COVID-19 since it's probably pretty relevant. In regards to breastfeeding. So there have been scientists studying breast milk in a lab pretty much since the start of the pandemic. They did find that mothers that have a COVID-19 infection create these antibodies and they do pass through into the breast milk. Similarly, mothers that receive the COVID-19 vaccine produce antibodies that are passed through the breast milk to the baby. So I personally think it's really cool that a baby who is still too young to be immunized at this time against COVID-19 has some protection without having to have been infected with COVID-19. So if anyone is interested, let me know. We'll have some time for questions and answers at the end. So if you want to hear kind of how I made my personal decision. So I did decide to get the COVID-19 vaccine while I was breastfeeding my youngest child. And I'm happy to talk about the information and the sources that I considered when making that decision, if anyone is interested. So let's move on. So I'll talk about the short-term and long-term health benefits. So in the short term, meaning while a baby is breastfeeding, they do have lower rates of ear infections, gastrointestinal infections, so like a stomach bug. When they get a respiratory infection, it tends to be less severe and they're less likely to be hospitalized. And there's also lower rates of sudden infant death syndrome. Long-term health benefits. So what that means is even after a baby is no longer breastfeeding, they continue to benefit from having been breastfed. So if they were breastfed, they now have lower rates of asthma, obesity, or type 1 diabetes. I should say, and type 1 diabetes. Okay, let's move on to mom because women benefit from breastfeeding as well. So there's some health benefits. So lower rates of ovarian cancer, breast cancer, diabetes, and high blood pressure. And again, these are long-term health benefits. So women that breastfed infants earlier in life have a lower risk of developing these later in life. So if you happen to have any family history or risk factors for developing one of these, it's kind of cool that you can breastfeed and actually decrease your chances of getting one of these later on. I also want to mention some other benefits to breastfeeding, and I will say that everyone's experience might not be the same as mine. So if you ask 10 different people, how breastfeeding went for them, you will probably get 10 very different answers. But I did want to share some perspectives of things that might be a benefit that you see with breastfeeding. So the first one I'll mention is cost. So in a very literal sense, when you feed your baby milk from your breast, you don't have to pay for it the same way that you would, buying formula at the store. I don't like to say that breastfeeding is free, because I think that mothers and women's time is worth money. And sometimes you might want to buy a nursing bra or a special pillow. So there are some costs, but your grocery bill might be lower. So that's something to consider. Convenience. I don't want to misrepresent to anyone. You will likely not see the benefit of convenience with breastfeeding in the beginning. So in the early weeks, and especially the early days, it's kind of a learning process for moms and their babies. So it probably would be more convenient at that point to bottle feed them. But for me and for some others, if you can get through those early challenging days, it starts to shift at some point. So for me, it was probably around when my first was around a month old. I remember waking up with him in the middle of the night at 3 a.m. and thinking, it's probably easier to be able to just feed my baby with my breast right now than to have to get up and make a bottle that I'm going to have to wash later. I'm lazy. I don't like to do dishes. So every time I breastfed was, one less dish that somebody in my house would have to wash at some point. But again, for some people, breastfeeding might be challenging the whole time. So if you talk to somebody and they're like, no, breastfeeding is not convenient, just know that it kind of depends on the person and how it goes for you. The last one that I mentioned is a little bit harder to define, but basically bonding. So for me and for other people, breastfeeding is often about more than just the nutrition that it provides for your baby, and more than the immune support as well. So for me, I viewed it as like another parenting tool that I could pull out. If my baby was sick, they often wanted to nurse more often, which was great for the immune benefits, but it also brought them comfort. I'll talk in a little bit more about some of the challenges that can occur with breastfeeding and how to get the help that you might need. But I don't want you to leave this presentation thinking, oh my gosh, breastfeeding is so awful and hard and it's going to be a struggle the whole time. For some people it is, unfortunately, and I wish those people had more support. But it also could be a really beautiful part of your parenting experience. So I just wanted to make sure that that was shared as well. I think that's all I have for benefits. So let's jump into the main part of my presentation, the resources. So if you want to breastfeed, if that is your goal, what kind of help might you need? So let's talk first about information. So like I mentioned, breastfeeding can be challenging. I hear it pretty often. Nobody told me how difficult this was going to be. And that's not everyone's experience. Some people, it's just super easy, super natural, but more often than not, I hear people surprised at how challenging those early days are. So if you have a specific breastfeeding goal, getting information at 2 critical points is more likely to make you successful. So number one, before you have the baby, in the prenatal period, getting education. If you know certain things before your baby is here, how do I physically hold them? How do I help them latch on? How do I know if they're getting enough? It's going to make you more confident and you're going to have a little bit easier of a time. And then the second time point is obviously once they're here, sometimes things, even if they're not going well, you might just want somebody to be like, yeah, good job. You're doing a great job. Or you might run into a challenge that you need some help there too. The breastfeeding class, the prenatal education could not possibly tell you every single challenge you might encounter. And if it did, you wouldn't remember it. So having access at both of those time periods is really critical, in my opinion. So my favorite source of information is professionals. So lactation professionals, it is literally their job to help people meet their infant feeding goals. So there's several different certifications that you can get to become a lactation consultant. I've listed IBCLC here, that's International Board Certified Lactation Consultant. That one's kind of the most rigorous. It has the most requirements. So it's science classes, there's lactation specific education. You work with breastfeeding patients. Once you meet all those requirements, there's an exam that you take just to validate that you know that information. So definitely some of the other certifications, you can get great help from those people too. But this one specifically I'm most familiar with, and it's kind of the like the highest level, like I said, the most requirements. So it's a good quality indicator. So lactation professionals can help you at those 2 time points that I mentioned. So they often lead breastfeeding classes that you can take before your baby is born. You also, before your baby is born, might be able to go in for a one-on-one consultation. If you have some sort of factor that might make breastfeeding more challenging. So for example, if you've had breast surgery in the past, you can go in, meet with one of these professionals and develop a plan. And then of course they can be helpful after your baby is here to help you kind of more hands-on with breastfeeding. So in the hospital, and that is often the only time that a lot of people have any contact with a lactation professional. And it's great that they do, because those early days, it's, you know, yours, maybe yours, and definitely your baby's first time doing it. So having that support there, but they can also help you once you go home. So they do office visits, and sometimes they can even come to your house to help with breastfeeding or with infant feeding in general. So how do you find a lactation professional? So I will talk more about insurance piece a little bit later on. I would recommend starting with your insurance company and ask if they have any call, or sometimes your insurance might have a website. If they have someone in network, that's the easiest way to make them pay for it. So I would recommend that. If they do not, you can check with your OBGYN or your healthcare team for both you and baby. Sometimes they have somebody that they refer to. This sounds obvious, but you can Google IBCLC near your city, your zip code, and sometimes you'll find some people that way. And then some of the lactation consultant organizations keep a directory. So I listed ILCA here because it's probably the biggest one. It's International Lactation Consultants Association. They've got this Find a Lactation Consultant feature on their website where you can click and kind of sort by location and try to find somebody that way. That won't be everyone, because it's usually if you're a member of their organization and you opt into the directory, but that's one way to try to find somebody. There's also local groups. So if your area has a local lactation consultant association, you can submit specific resources at the end. Okay, so moving on, my next source of information is the internet. So the internet has a lot of information about breastfeeding, which is great. So it's free, it's often convenient, and some people learn really well that way compared to other formats. I would encourage you to consider the source. So if you have a clinical lactation problem, so for example, if you're worried, I'm not really sure if my baby is getting enough to eat, or I think there's a problem with their weight gain, go to a professional. But I do think social media, I'm sorry, not social media, the internet can give you some good information in other ways. So basics. So if you are just wanting to get started out, these websites will give you some starter info, how to hold your baby, how to know if they're getting enough to eat, that type of thing. So breastmilkcounts.com, and the one right below that is the Spanish version of that website. And then the WIC breastfeeding. So women, infant, and children, they have a wonderful website with breastfeeding information. I also have some resources for pumping. So some people, when they breastfeed, use a breast pump or some other way to express milk from their body and give it to the baby in a bottle instead of putting the baby to the breast. So some people do that full time. Some people breastfeed when they're together at the breast, and then if they're separated for work or for some other reason, they'll just pump while they're apart and then still nurse when they're together. So if you need to use a breast pump for any reason, you'll want to check out this resource. You can't see it against my background, but it's down here in black. The CDC information. So it's got some good info on how to store breast milk. So how long is it safe in the fridge, in the freezer, in the deep freeze? How do you thaw it? How long is it safe after thawing? And some guidelines on how to feed that express breast milk and how to clean your breast pump. So it's not a very interesting read, but it's good information to have on hand. So a lot of people will print it out and kind of have it handy. The last internet-based source of information I have is medications. So if you take a medication, either prescribed or over the counter while breastfeeding, it's a good idea to check to make sure that it's safe for breastfeeding and that it is not going to impact your milk supply if that's important to you. So my two favorite sources of information to learn that about the medication you're taking. So Infant Risk Center. So that is a group out of Texas Tech University. It's ran by Dr. Hale. He's a pharmacologist and a PhD researcher, and he's actually studying the safety of medications taken by a mother. So he looks at how much they transfer into the breast milk and if it's safe for the baby. Their website that I've listed here has a common medications download. So if it's, common medication, you might be able to find your answer quickly that way. They also have an app that I've listed here. So Mommy Meds, it's not free. When I downloaded the health professional version a few years ago, I think it was like $3 to $5. So you can find the information for free. But if you are on a lot of medications or kind of want to have access to this, that is an option. And then the Infant Risk Center also has a call center where you can actually call and speak to someone on their team and ask them specific questions about a medication, and they can give you advice. LactMed is another online resource, and they have a database of medications. So you can search by medication and see the breastfeeding safety information. I would caution you, if you are prescribed a medication and you are told you need to stop breastfeeding or you need to pump and dump while you're on this medication, that very well could be true. There are some medications that are not safe for breastfeeding, but I would maybe just double check that information. And the main reason I say that is I have seen professionally, as somebody who prescribes and also has a little bit more information about lactation, sometimes a mom will be told to pump and dump or to stop breastfeeding for a medication that's literally in the very safest category. So some health professionals might not be aware of this information. So they might just be going on the information that the drug company sends. So the drug company does not study the safety of the medication in breastfeeding. And it's probably a lawyer writing their information that they send out, and they're like, well, we didn't study it, so we're just going to say don't breastfeed on this medication. So my preference would be to check with Infant Risk Center or LactMed, and certainly you can have a conversation with your provider, but that would be my recommendation. Okay, so moving on from the internet, social media. So I started to get into this a minute ago, but social media, I kind of lost my place in my mind. So if you have a clinical problem, go see a professional, but social media is great, especially for support. The evidence actually shows that you are more likely to meet your breastfeeding goals if you have appropriate peer support. So if you don't have people in real life around you that maybe have babies around the same age, you can kind of connect with people this way, celebrate your successes, commiserate when things are challenging, and it can make early parenting feel a lot less lonely. So I would recommend it. Lactation professionals are also often content creators. So I follow a lot of lactation consultants on Instagram and TikTok because I think it's a really fun way to present information. I've highlighted one here. So it's at the Milk Manual. This is Erica. She lives in Houston and she's an IBCLC. She's on Instagram and TikTok, and I've got her handle there. If you're interested in breastfeeding, you should go follow her because she's awesome. One of the things that she does really well is that she demonstrates concepts that are easier to see than they are to read about or maybe hear about. So for example, sometimes when we are helping somebody breastfeed, we'll tell them, hold your breast like a sandwich. And that sounds kind of weird, right? What does that even mean? But Erica has a video where she literally holding a sandwich and she like, squishes it down so you can pour into your mouth. And it's really good because it's funny and it demonstrates the concept of why holding your breast like that might get more into the baby's mouth and make breastfeeding work better. So yeah, I really enjoy Erica's social media, so you should go check her out. And then the last social media information resource, I guess, is advocacy and normalization. So I'll talk more about some kind of laws and different things, some more structural barriers to breastfeeding. And if that's something you're interested in, so I'll talk a little bit about maternity leave and some of the insurance access to lactation. So if it's something you feel passionately about, social media can be a good way to kind of stay in the loop. So what do we have going on in our society that helps people meet their goals? And the normalization. So I did want to mention, we do have different rates of breastfeeding in different racial and ethnic groups. So one of the really cool campaigns on social media is Black Women Do Breastfeed. And that's Black women sharing their experiences and sometimes pictures with their nursing experience. And I think it's a really positive thing for people to see people that look like them breastfeeding and meeting their goals. So there's some really cool spaces on social media for breastfeeding that you should check out. Okay, I'm going to move on to insurance, and hopefully it's not as boring as it sounds. I think there's exciting information here. So I'll start with what benefits your insurance might cover. So breastfeeding support. The Affordable Care Act, which you may know as Obamacare, requires insurance plans to cover preventive care with no cost sharing, and that includes comprehensive lactation support. So let me kind of break down what I just said. So comprehensive, meaning it does not only cover lactation support in the hospital, which is what some people believe. So your insurance plan should cover that prenatal education, so either a class or a one-on-one consultation, depending on your needs, and then also postpartum in the hospital, but after you go home, they should cover that as well. No patient cost means you should not have a copay or a deductible. So it's in the same category as if you went for a well woman exam or your annual physical. Usually you should not have a cost associated with that. And it's the same thing for this lactation support. There are a few exceptions. So certain plans that were established before a certain date and have not made significant changes are grandfathered in where they don't have to cover the lactation support. Texas's version of Medicaid does fall into that category because they're one of the 12 states that have not expanded Medicaid. So they don't have to cover it, but I will give you some resources, especially for the Houston area for people who might have plans that are grandfathered in. But a lot of people don't know this, so I wanted to share that. The next benefit that more people tend to know about is breastfeeding supplies. So insurance companies are required to cover for a breast pump at no cost to you. The logistics kind of vary by your insurance plan. So some of them have you order through a specific company. Sometimes they might have you order it and then turn in your receipt and they'll reimburse you. So it kind of depends. Just call your company, say, hey, I'm pregnant, I need a breast pump, and they'll kind of tell you what the plan is for that. I will mention they don't have to cover for a specific type of pump. So sometimes there's a possibility that they only cover a single. So double breast pumping, meaning you're pumping both breasts at the same time, is faster and it's usually more effective. So they might just give you a setup to do one at a time. And they also could possibly give you a manual, meaning a hand pump where you're like literally doing it by hand, versus an electric where you push a button and it does the work for you. But so that's a possibility. I actually know one person that was given a single hand pump, but most people that I know, both family, friends, and professional, usually they're for electric breast. And that's usually what you would want if you're staying at home and you're not going to be away from your baby for significant amounts of time. Okay, navigating insurance. So if you only click on one link for my whole presentation, I hope that it is this one because it's really good. Actually, let me pause. I think Kayla is going to send out my Prezi link after, and I tested it to make sure my links work. If you open it in a browser of your phone, the links don't work super well where you can click on them, but if you open it in the desktop, they do work. Or if you only have access on your phone, you can download our easy eye, it'll say it in the link she sends out, but you can open the links that way too. So I just wanted to make sure everybody was able to access these links that I'm telling you should click on. Okay, back in this. So this is toolkit. And so it goes into a lot of detail on what insurance is supposed to cover. And it talks a lot more about those grandfathered in plans. So what might qualify them for an exception. The very coolest thing about this document is the sample script that they provide. So if you're like me, calling insurance and trying to figure out what in the world is going on can be intimidating and confusing. So this toolkit, it's set up like a flow sheet. So basically they have like written out for you, call and say, for example, hi, I am pregnant and, or, I had my baby and I need to see a lactation consultant. Is this a benefit that my plan covers? And if they say, yes, your plan covers it, but we don't have anybody in network, sorry, you're out of luck. Well, then your next step would be, oh, my understanding of the law was if you don't have anyone in network, I can go see them and you should reimburse me for that. So that's just kind of one example. It kind of goes into different scenarios. I think it will make you more confident making that decision and just kind of knowing what your rights are. There's also a sample appeal letter. So if your plan is not grandfathered in, but they are still refusing to cover the lactation services, I personally think it's really important to hold them accountable to what the law requires them to do. So kind of starting the process and documenting if they are not compliant by sending this appeal letter, and hopefully we can make some change in this area. Okay, that's all I have for insurance. I will talk a little bit about back to work and some of the laws that apply to that. So going back to work can be a really challenging time for breastfeeding. So first I'll talk about family leave. And I wish I had better news on this slide. In my opinion, we have a lot of work to do in this area. So Family Medical Leave Act is a federal law. Some states may have extra protections for family or parental leave. Texas does not. Some companies may have policies that provide more coverage. They might say, hey, even if you haven't, if you don't qualify for FMLA, we'll still let you off or we'll pay you. But basically what FMLA is, oops. Okay, there we go. What FMLA is job protection. So if you have a family or medical event that qualifies and the birth of a child does, you can take up to 12 weeks off of work and they will still have your job for you when you come back. Now, they don't have to pay you for it under this law. So often it's unpaid, or you can use accumulated paid time off, or sometimes a disability policy may pay for some of your time off. There's also exceptions to it. So only about 60% of the workforce in the United States does qualify for FMLA. Your company has to have more than 50 employees. You have to have worked there more than a year, and you have to have worked there a certain number of hours. I will say, even if you don't qualify for FMLA, it probably doesn't hurt to ask. With my last child, I had not been at my company quite a year, and I told them, hey, I'd still really like to take 12 weeks off after my baby is born, and probably the worst they can tell you is no. So, but hopefully we make some progress in that area. Okay, the Affordable Care Act has a section for break time for nursing mothers. So basically this requires employers to provide reasonable break time to nursing mothers to express breast milk. They also have to provide a private space that is not a bathroom for you to express that breast milk. Again, there's some exceptions based on the size of the company, but most people should qualify for this one. Now, they are not required to pay you, so it depends on your break time. If you normally get, a paid 30-minute and 2 paid 15-minute breaks, they can't make you clock out for those because you're going to express milk. But if you normally have to be unpaid for all of your break time, they might require you to be unpaid for this as well. Knowing this ahead of time, it's, in my opinion, it's a good idea maybe even before you go out on your leave to have your baby, talk to human resources or your manager and say, hey, I plan on expressing milk when I come back to work, and I'll, need to do that around this time, this time, and this time. Do you have a space for me to do so? So just kind of knowing your rights when you have that conversation. Childcare centers. So this is usually state laws. So Texas state law says that licensed childcare centers must provide a comfortable place to breastfeed. And that would usually be in the morning, you're dropping off your baby, or when you pick them up, if you need to breastfeed them before you get in the car and go somewhere, they should have a place for you to do that there. You also, if you work close enough to where your child is in childcare, you can go over there during the day to feed them. The law also says you have the right to provide breast milk while your child is in their care. And basically what that means is if they're a licensed child care center, they can't say, no, we actually don't handle breast milk at this facility. They're going to have to be on formula if they're here. So that's not allowed. The last thing that I have here, this link, is tips for caring for a breastfed infant. So this is not a law. This is just a document that can give some helpful information. So sometimes babies that are breastfed feed a little bit differently in terms of timing or amount than babies that are only bottle fed. So knowing that information can help somebody that's taking care of them. There's also information on pace feeding. So basically a way to bottle feed a breastfed infant that is supportive of them continuing to breastfeed at home, if that's important to you. So this isn't only for childcare centers. If you have a family member or somebody else that occasionally watches your baby, there might be some helpful information here that could be useful to them. The last one I have, breastfeeding in public. So this doesn't have to do with back to work, but I did want to mention it. So this is a legally protected thing in all 50 states. Wherever you are legally allowed to be, you are allowed to breastfeed. You can also do so with or without a breastfeeding cover, whichever way works better for you and your family. Okay. To my last section. So some Houston area resources. So I did want to just highlight a couple. There's more than this out there. And I'm sure there's some really wonderful ones that I missed. But Bayou City Breastfeeding, this is a group of infant feeding specialists and lactation consultants. They do have offices in several locations in Houston, and they also do home visits. They are in network with several insurance companies, and if they're not in network with yours, they will provide you a receipt for reimbursement. I think they also do a cash payment discount. And then one of the main reasons I wanted to include them is they have this grant program where they set aside a certain amount of money per month. So if your insurance, is one of those grandfathered plans, you can use this grant program to cover some or all of the cost of your visit. So for those with a financial need. I didn't include their link, but if you Google Bayou City Breastfeeding, I don't think it'll be too hard to find them. The other one I wanted to mention is the Lactation Foundation. So this is a collaboration between the State of Texas Women's Infant and Children Program and UT Health Department of Pediatrics. So again, it's lactation professionals and infant feeding support. They do several things. So they have classes, they do consultations before or after your baby is here. And they also have a weekly support group. They are only in the office, so they do not do home visits to my knowledge, but they are funded through a grant, so it is no cost to you. So all their services are free. So this is a really good option for people that have one of those grandfathered in plans, including Medicaid, but you don't have to be on Medicaid or have one of those plans or be on WIC to qualify for this. So everyone, it's open for anyone to go. And I've got their link there, so you can check out the Lactation Foundation. So I think that is actually my last slide. So I would be happy to answer any questions if anyone has any.
Awesome. Kelsey, thank you so much. I know I am not currently a mother, but I do want to have children. And when I think about some of these things, it seems very overwhelming. So this was very, very a great presentation that I know I will be referring back to. I really appreciate all of the resources that you provided. So we are opening the floor for questions. We're a smaller group today, so if you want to unmute yourself to ask your question, you can definitely do that. or if you feel more comfortable adding a question into the chat box, we can do that as well. I will go ahead and start off with the first question to get us going. So in your disclaimer, which I love that you had that disclaimer in there, you mentioned that, some of the reasons why women may choose not to breastfeed are medical reasons, or, mental health reasons, biological reasons. What may be some of those things, or examples that you could give us for why a woman who may want to breastfeed may not be able to?
Sure. So from a medical standpoint, okay, so this is a rare example, but I'll start with babies. So sometimes this is more rare, so I don't want people to worry that this will necessarily happen to them, but some babies cannot tolerate breast milk because of the enzymes. There's some different metabolic diseases that they have to be on a special formula. That's pretty rare. More commonly, it would be a problem with mom, and maybe not problem is the right word. So breast surgery, depending on what kind, can sometimes alter how milk is able to come out of your breast. So that can be a challenge. Some women have conditions that make it harder for them to produce enough milk. And so they might formula feed, or they might combination feed, where they feed their baby the milk that they can and supplement with formula other than that. Let's see. So sometimes a mom might be on a medication that is not safe to use with breastfeeding, but she does need to be on that medication. So that would be one reason. There's certain so if you have HIV, that is a reason not to breastfeed, because that can pass through the milk to the baby. Yeah, so those are kind of some of the basics. I would say most commonly, in terms of medical reasons, it would be problems with supply. And sometimes that is a underlying medical condition. So thyroid, PCOS, anemia, meaning they have low blood count. Sometimes those things can contribute. Sometimes it's based on behaviors or logistics. So this is probably getting more into detail than we need, but breast milk supply is based on demand. So the more a baby feeds, the more you remove milk from your breast, typically the more milk you will make if everything's kind of working normally. So sometimes there's barriers to getting baby to be able to remove that milk from your breast, or having the time to express at work that you might need to. So I hope that sort of answered your question. That's just from the medical standpoint. There's other things too.
Absolutely. Yeah, that definitely answered my question. So if you are interested in breastfeeding, that is a conversation that you could have. I know you mentioned kind of utilizing resources beforehand. That can kind of help. So that could be a conversation that you could have with your provider to maybe see if that is an option for you. Okay, so we have a question in the chat. And the question is, how does PCOS affect breastfeeding?
PCOS is so for those that don't know, so it's polycystic ovarian syndrome. It is a disease that's kind of complicated. So it's hormones and metabolic factors that maybe are not functioning as they normally would. Kind of a general rule is, if you are hormonally able to conceive, to get pregnant, theoretically you should be hormonally able to breastfeed as well. So meaning all those like hormones from your brain that send signals to make milk should be working well enough if you were able to get pregnant. But sometimes people with PCOS do report lower supply, just because the connection between the hormones and the metabolic functioning is not quite there. It's probably not a very super clear way to explain it, but sometimes it just is lower supply because the hormones don't work the same way they do in people that don't have PCOS. Did that answer your question, Angela?
Yes.
You're
Yes.
welcome.
Thank So the next question that I have, so you talked a little bit about when you mentioned the social media account that you follow, the Milk Manual. I actually looked it up. So I'm going to be browsing her page later today. But if you notice that your baby is having trouble latching, is there anything that you can do to help?
So if you are having trouble latching, I would highly recommend trying to work with a professional as much as you can. There are some resources online. There's videos on YouTube. Sometimes you can like watch a latch, like things like I mentioned that are easier to see. Sometimes that will make something click for you. But really for those cases, I would recommend working with a professional. Just to make sure, because so the latch, a lot of people have pain with breastfeeding, and that can be much worse in the early days if the baby is not latching well. And I see a lot of parents say, you know what, it hurts, but I want him to get breast milk, so I'm just going to push through it. And I say, no, 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 don't do that, because not only, well, we don't want you to hurt, but also if the baby is not latched on well, they're not transferring milk effectively. So sometimes it can lead to them not getting enough to eat, losing too much weight, and that also negatively impacts your milk supply, because if they're not removing the milk well, your body doesn't get those signals to produce enough milk for them. So latch issues, as much as possible, try to work with a professional so that you can make some adjustments. You will, so one of Erica's videos that well, if you were browsing, you might have seen it. I think it was a recent one. She just kind of shows like a really simple, like instead of your baby's head being over here, like if you shift him over, it helps you get a deeper latch. So sometimes it's simple like that. But if you do think it's a concern, try to work with someone.
Awesome. The next question that I have, so I know that there are, or I've heard that there are certain things that maybe you should avoid while you're breastfeeding in terms of diet. Do you have any like specific foods or beverages that you have on a list of things that should be avoided and things that should be consumed?
So I do not actually. Most foods are relatively well tolerated in breast milk. So there's some foods that might increase or decrease milk supply. Some babies are really sensitive to like gassy foods. So if you eat like a whole plate of cabbage, if you're gassy, maybe the baby will be a little bit gassy too. But no, generally, I advise most of my patients eat a regular diet unless there's a problem. If there's a problem, if there's something going on with your baby, sometimes we'll make some dietary adjustments to try to see if that's what's causing it. But no, diet generally pretty good. Alcohol is a pretty common question I get as well. Is that safe with breastfeeding? And basically, the way that works is alcohol does not stay in your milk longer than it stays in your bloodstream. So the amount of alcohol you have in your bloodstream is approximately what you have in your milk. So for example, if your blood alcohol, oh gosh, I don't probably know the accurate numbers, but is it like 0.4, 0.04? This is not something I think about every day, but that's about what it would be in your baby. So it's a very small amount. It's not like they're drinking, that 5% beer or, 9%. I don't know the percentages, but they're not getting the same amount as you're getting from the alcoholic beverage that you're putting in your mouth. So sometimes they'll have women drink your alcohol like right after you feed your baby. That way there's a longer stretch before it's time to feed your baby again, so that more of it gets out of your system. But generally speaking, I heard somebody say, if you can safely hold your baby, you can safely breastfeed your baby. So if you are too impaired that you wouldn't feel comfortable holding an infant because you have that much alcohol in your system, probably don't breastfeed them. But generally the advice to pump and dump is kind of the old school way to do it, is not necessarily the greatest advice for people that use alcohol, on a casual basis. You didn't ask that, but I shared it anyways.
No, no, that's good to know. I'm sure that that is a question that was going to come up anyways. So thank you.
I have a question. So I am actually at my delivered my baby 3 weeks ago, so I'm currently breastfeeding. Thank you. I've been on mute because I actually was currently breastfeeding while you were while you were doing this. So I developed mastitis on Sunday, and I wasn't expecting the symptoms to be like the flu, and that's kind of what happened. But what kind of preventative measures do you have for that?
So mastitis can happen for a couple different reasons. Probably the most common one is milk that gets stuck in the breast, basically. So it might happen after you miss a feeding. So say your baby starts sleeping through the night, or if you were to go back to work and just not pump the whole time you were there when you were at home, you were feeding your baby multiple times a day. So sometimes milk getting kind of stuck in that area can lead to mastitis. So if that is the case, if you feel, so sometimes you'll actually feel a lump or some pain in that area. Sometimes if you catch it early enough, it will not turn into mastitis. So you can massage the area. You can apply warm heat, so like a warm washcloth. Basically, our goal is to get the milk out. So feeding the baby often as much as they want to. They're hungry. You've got milk in there. Let fix each other's problems. So sometimes catching those clogged ducts and removing the milk early enough can help. There's some other like more specific techniques depending on how bad it is, but that's the basics of it. Mastitis can also occur if you get an infection like on your nipple. So mastitis is an infection of the ducts, so kind of further back in your breast, the area that collects milk before it comes out. If you get an infection on your nipple, which would most commonly be if the baby doesn't have a great latch and you have some trauma, so maybe you have some cracks or at some point you were bleeding, an open wound is a source for infection to get in. So sometimes that can lead to mastitis. And in those cases, we want to correct the latch, treat the infection on the nipple. If you have infectious mastitis, so if it's red and hot, and it sounds like you did with the flu-like symptoms, at that point, I would not encourage the home therapies, and I would go see your home provider. Sorry, not your home provider, your health provider, because usually antibiotics are needed if you have mastitis like that.
Yeah, I actually did get an antibiotic, so
good.
I'm feeling bad, but it was
a
rough couple days there.
Yeah, it's not fun. And some people are really prone to it. For people that have recurrent mastitis, there's actually a supplement you can take. It's, I'm probably going to say it wrong. I'll put it in the comment box in case you can't understand what I'm saying, but it's lecithin. So there's soy or there's sunflower, and it basically makes the milk a little bit more slippery so it doesn't get stuck in those ducts as often. So not everybody has to take this, but people that I know that have, like, they just kept getting mastitis, when they take this supplement, it can help. So hopefully I covered your question there.
Oh, thank you so much.
You're welcome.
Yes, that was a great question. And I hope that you're starting to feel better after getting your antibiotic. Yeah, I don't want to think about that pain. And that kind of leads into my next question, which was, is it okay to continue breastfeeding if you are sick? So if you have a cold or you have the flu, is it still okay for you to breastfeed?
It is, with the exception of a few. So, I mean, if you contract HIV or something, like that, obviously no. Active tuberculosis, I think, is one of the other ones. But generally speaking, cold, flu, respiratory illness, if you have been around your baby breastfeeding them and then you start to feel sick, you've likely already exposed to them. So the benefit of continuing to breastfeed them and giving them those antibodies, they'll likely do better than if you were to like separate and isolate yourself away, and they weren't continuing to get that breast milk. So yes, generally speaking, for most illnesses, it is safe to continue breastfeeding when you have mastitis too. I forgot to mention that because some people think, oh, is the milk infected? No, it's the duct. The milk is safe to continue breastfeeding for mastitis and for other common illnesses like you mentioned. Oh, you're muted, Kayla.
I'm so sorry. I keep muting because we have traffic and I don't want to get it in the video. What do you think about things that promote milk supply?
So, Robin, correct me if I'm wrong. Are you asking about like supplements or like lactation cookies or that type of thing?
Yes, things like cookies, teas, things that claim to promote better milk supply. What do you think about those? Do they actually work, or yeah?
That would not be my first choice. If a mother has a concern or a parent has a concern about milk supply, I would, number one, make sure that it is based on factors that are an indication of milk supply. So what I mean by that is sometimes there's a perception that your milk supply is low. So pretty commonly around the 3-month mark, a lot of women stop leaking if they were leaking before, or their breasts, when they're full of milk, no longer feel kind of like firm and full of milk. They start to feel softer all the time just because your body is more like regulated with the milk volume kind of changing in your breast throughout the day. So I would probably first make sure, that it's not like a concern that is not based in reality, I guess is what I'm trying to say. I mean, I low supply does happen. But number two, I think that getting appropriate breastfeeding support is probably going to do more for your supply than the cookies or the tea will. And I do think that they have some use. But basically what I'm saying is if it's low supply in the beginning because the baby isn't latching on well and removing milk, all the cookies and tea in the world aren't going to fix that latch. So getting the support that you need to like make breastfeeding work, I think is more important. There's also, like I mentioned, supply is generally mediated by supply and demand. So sometimes if you're pumping, throwing in an extra pumping session, there's some different techniques you can do like that, will help get your supply up more. Now, the galactagogues, which is the kind of fancy term for supplements or medications that we give to increase milk supply, it depends. So I think that some of them do have a legitimate way to help increase your milk supply. Unfortunately, some of the common ones can actually do the opposite. So you don't know how your supply is going to react to them. So I tend to recommend them last, kind of as a last resort. Eating cookies is great. Eat all the cookies you want, but also get support for your needs. So I think there is some use for them, but they're not my number one go-to.
Thank you.
You're welcome.
Okay, so I have one final question for you before we kind of wrap things up. And that is, if you could have everyone on this call or everyone watching this video, provide them with one final takeaway message, the one thing that you would want them to get from this presentation, what would that be?
Good question. I think I would have to say that if it does not go the way you intend, with infant feeding or really any part of parenting, sometimes you have expectations of the way your birth, breastfeeding, all these things are going to go. And a lot of times they don't go according to plan. I sometimes hesitate to talk about the benefits of breast milk because I do know that that can be harmful psychologically to people that did not meet their breastfeeding goals. I don't want to say successful in breastfeeding because some people have different goals. And some people say, you know what, I want to feed in those early weeks when their immune system's really immature, and then I'm not going to breastfeed. So I guess my point is, if you don't meet your feeding goals, if you don't breastfeed as long as other people might think you should, that's okay. You are doing what's right for your family. It's obviously better for your baby to be well fed than to continue breastfeeding and them not be getting enough milk. So make the decision that's best for your family. Be confident in that and seek out people in your life that will be supportive of your choices and how you do what works for your family. So I think that's probably the most important thing that I would like to say.
Thank you. That is great advice. And I'm sure that it's going to be something that we on this call pass on to other people in our lives that we know may be breastfeeding or considering breastfeeding. Few slides to wrap up the presentation today. First, if you maybe are like me and you walk away from a presentation and then a few days later you think, oh my gosh, I have a question now, you can always email us at healtheducator@thewomensfund.org and we will work to get your question answered. I've also provided a survey link that will be sent in the follow-up email. We would really appreciate if you would take a few moments to complete the survey, let us know what you liked about the presentation, what we could improve on, things that you are interested in hearing about as well. We would love to have your feedback. And I forgot to mention this, but we will be sending over a link for Kelsey's presentation. So all of those great resources that she shared in the presentation, you will have access to those. So I have our social media pages and our website here on the left-hand side. I encourage you to go and follow our social media pages. We post about upcoming events like this one, as well as other things that we have going on here at the Women's Fund. And then as far as upcoming events, next week we have a presentation with Dr. Melanie Mazoon over breastfeeding basics. And the following week, she will be presenting again over vaccines and immunization. So if you're interested in those presentations, they are up on our website for you to go ahead and register. But we really appreciate you taking the time out of your day to be here with us. And Kelsey, thank you so much for this wonderful presentation. I definitely learned a lot.
Thank you for having me. I love talking about this topic.
Well, thank you all so much, and I hope you have a great rest of your day.